Over the last year, I've slowly started stepping back from pelvic floor physical therapy. Now, I still want to help women with pelvic floor issues, especially when those issues are keeping them from running, lifting, or doing the things they want to do. But my idea of what it means to be a pelvic floor physical therapist has evolved. So in this episode, I share my own experience with athletic urinary incontinence and how it led me to pelvic floor physical therapy in the first place, why my approach to pelvic floor PT has changed, and where it fits into my practice now. Hello, and welcome to Candid Conversations with Dr. Kelsey. I'm your host, Dr. Kelsey, and this is the space where I share my honest thoughts, real experiences, and the no BS conversations I wish more people were having about movement, training, injury recovery, and life as an active human. The goal of this podcast is to help you better understand your body, think more critically about rehab and fitness, and feel more confident making decisions so you can stay active long term. Before we start, a quick reminder. I am a physical therapist, but I am not your physical therapist. Nothing here is medical advice, so if you're dealing with something specific, please reach out to your PT or schedule a session to work with me. All right, now let's get into today's conversation. So when I was in college, I started experiencing what I now know is called athletic urinary incontinence, and this was specifically with running. So basically I would pee my pants, but only with running. And it wasn't every single time I ran, which was the frustrating part. It was only for example, in the last half mile during my 1.5 mile run during the fitness test for ROTC. But even then, it wasn't after every single time I did a fitness test. So in that case, if it was, then it would have been easier to predict, but it wasn't really predictable when I would start having these symptoms or which day I would. So yeah, it was pretty isolating, partly because at that point in time, peeing, not just with running, but just having incontinence was only associated with either older women, or sometimes we would see I would see commercials for maybe postpartum women, but for the most part, I think it was only older women is what it was associated with. And again, it's there were I could wear a pad or whatever. There were ways to kind of prevent myself from leaking through my shorts and stuff, but again, there wasn't really a way for me to predict when it would happen, during which runs it would happen in. And so yeah, it was super isolating. I knew that it probably wasn't normal, but I didn't really know where. One, I was embarrassed to just go to the student health center and ask about it, because again, this was something that was only associated with older women. And when trying to Google my symptoms, there weren't any other people, it seemed who didn't have kids having this issue. And I figured even though it was a problem, I didn't think that maybe a urologist, I didn't think it was serious enough to have to go to a urologist or some other specialist. So yeah, I did nothing about it. It was incredibly isolating. Luckily, it eventually kind of went away, it seemed on its own. It stopped happening as frequently. But then fast forward a few years later, so now I'm in it's when I'm in the Air Force. I'm in North Dakota, and after I've been doing CrossFit for several years, I didn't have problems with double unders for several years, but I started having when the issue with peeing my pants came back. This time it was pretty much only with double unders. Sometimes if there was double unders and toes to bar. Now, in hindsight, I think it's just from that compression of my lower abdomen, over when you do toes to bar. But anyway, so started happening with double unders in CrossFit a few years later, and now by this time, I think it had become a running joke that that so not only like postpartum women, but like women in general would pee their pants with jump rope. And it was kind of like, it was like this weird, and it still is, I think, this weird thing of like kind of taboo, like there's like the hush hush, everybody kind of knows about it, and but like not really something you talked about, but also like everyone experiences it, but like it's just something that comes with being a girl, I guess, or especially if you've had kids, and there's nothing you can do about it, basically. But then, so still around this time, maybe a year later, I find out about pelvic floor PT. So this was after I had already decided to go to a physical therapy school, and it was around the time that I was applying to school. So I hadn't gone to school yet, and I found out about this after like a coworker, so someone in my squadron who was pregnant at the time, she posted something about pelvic floor PT for pregnant and postpartum women. And I read the article and I was like, oh my gosh, like, why have I never heard of this? Why has no one ever heard of this? Like, people, the way people talk about like leaking when you're doing double unders or running or whatever, like, they talk about like there's nothing you can do about it when there actually is. And so it's like, why don't more people know about this? And so that's kind of that was kind of my first like realization that there was something that you can do about it. And it was also like another realization that like if I had known about this, like, I don't know, like 3-4 years earlier, I don't know, like the timelines, I can't. Yeah, it was probably like 3 or 4 years, or yeah, earlier, then I could have asked for it. Then it would have provided me like a path that I could have gone down to try to solve my symptoms, because yeah, eventually they went away, but like at the time I didn't know that they would go away. And so it would have saved me a lot of worry and a lot of stress. And so once I learned about pelvic floor PT, I was like, okay, this is what I want to learn about when I get to school. Like, I'm interested in it, and, you know, I kind of want to maybe pursue this path. And so I start physical therapy school. And so the thing is, you know, I was still interested in pelvic floor, but I was and am still very interested in orthopedics as well. And so, you know, orthopedics, it's like what most people think about outside of the hospital about physical therapy. So like the bones and joints and stuff, bones, muscles, joints, like that's kind of orthopedic. And so by the time I graduated physical therapy school, in my head, like in an ideal world, I would practice like 50-50. So like half of my patients would be orthopedics and half of it would be pelvic floor. But I knew that wasn't going to necessarily be realistic, at least in like, I guess you would call it the corporate, like at least in the traditional sense, because, you know, at this point I already knew and understood, like, you know, and as you can probably attest as well, like you see orthopedic clinics. So there's like physical therapists who only do orthopedics, and it's usually the outpatient ones. And then there's like pelvic floor physical therapists. So they only do pelvic floor. Like aside from like the people who start their own practices, like I feel like it's pretty rare to be 50-50. It's like usually the ortho people, obviously because they don't have the training most of the time, maybe they have like one continuing education course, but for the most part, the orthopedic physical therapists like stick with orthopedics, and the pelvic floor physical therapists stick with pelvic floor. Maybe there might be like a little overlap, like if a particular clinic offers both specialties, like maybe the pelvic floor therapist will, like if there aren't as many pelvic floor patients, like maybe she'll take a couple ortho, and then some of the more like straightforward cases, like straightforward pelvic floor cases, maybe they'll be seen by ortho, but usually it's pretty separated. And so when I graduated, I was like, okay, I already knew at the time that I kind of wanted to start my own thing eventually. And so my ideal like business would be half and half. Like I would see, I mean, I know like it wouldn't always be 50-50, but ideally I would be like, it would be like half orthopedic patients. So like the normal, like knee pain, shoulder pain, whatever. And then half pelvic floor patients. So that was my ideal caseload. I never intended to be like only a pelvic floor PT. So when I started my career, so when I graduated, I was only able to get a job at orthopedics. So I did apply to a pelvic floor for a pelvic floor position, but then they wanted me to sign a non-compete, and I was like, no, thank you. But so it was a whole thing. But anyway, so my first job was as an orthopedic physical therapist, and so the other thing was that in school, I never had a chance to get more clinical mentoring with pelvic floor physical therapy. So I was able to shadow. So at my last clinical rotation, I was able to shadow the pelvic floor physical therapist. So that was when I was like, okay, yeah, after seeing all this, I still want to do this. When I graduated, I got certified for internal examinations. I did a continuing education course. The only thing I didn't do is because it was added later was take the test. So I could be certified for through Institute of Clinical Excellence for their pelvic division, but I didn't take the test. It's a long story, or it's not that long of a story. But anyway, I've done the education. I've pursued the continuing education. I've gotten the certificates, but the only thing that was missing was the mentorship. And so before I started my practice, when I was still in like a regular clinic, I tried seeking out mentorship for pelvic floor, because I mean that's how you get better as a clinician. And for a while I was in a pelvic floor journal club, and that was like gonna be part of my way to get mentorship. But then so I was like really excited to join this club and everything and like learn, but eventually like it was after like the second or third meeting, like it became clear that the person leading the journal club, like leading the discussions, and some of the other pelvic floor physical therapists in there, like they didn't like CrossFit. And so, going back, like my entire evolution, I mean, the problem that I had with athletic urinary incontinence started with running, but it also like went into CrossFit. And at the time I was like really CrossFit was going to be like my main focus in my practice. I mean, now I still do focus on CrossFit, but now I've added like triathlon and high rocks and like I'm not limited to those three, but those are the three that I focus on. But at the time, I was going to focus on CrossFit. Like that was going to be my niche. And then so it was really disappointing that these women were like didn't like CrossFit at all, and they were basically under the attitude that the reason why so many women are having these pelvic floor issues is because of CrossFit, and these women should not be doing CrossFit. And then so it's like if like a CrossFitter comes to them with pelvic floor issues, obviously they'll still help them. I mean, they're not gonna like deny service, but they're gonna like try to convince this woman to not do CrossFit anymore because that was like why they were having issues or whatever. And so that did not align with me at all. Obviously, because I still wanted to do CrossFit, but also like my own philosophy is that I want to help the person get back to what they want to do. Yeah, obviously if it's CrossFit, I want to help them get back to CrossFit. But even if it wasn't CrossFit, even if it was like MMA fighting or like trampoline jumping, I don't know, something that I don't do, but I'm not going to judge someone for what they want to get back to. Like my job is to help them get back to it and that's it. Like, my job is not to put my opinions on them. So eventually I stopped going. And so I feel like that's kind of like the undercurrent of like, or foreshadowing, I don't know, of like my pelvic floor physical therapy career, until up to like right now, present day, is that I don't know, I've just been fighting this like weird establishment, but anyway, so yeah, at this point, I'm definitely comfortable with treating incontinence. So what I originally was interested in for pelvic floor physical therapy, but you know, with my education, like, I've learned like, oh, there's like all these other things too. Like, there's prolapse, there's like pelvic pain, and there's like more complicated cases of pelvic pain and all that stuff, and everything else. Like pregnancy and postpartum, I feel like that kind of goes into the incontinence. Obviously, there's going to include some prolapse and some other more complicated things, but for the most part, I'm pretty comfortable with like those three, like incontinence and then pregnancy, postpartum, for the most part. And for the more complicated things, or the more complex, I guess, is a better term than complicated, I figured that eventually maybe like I will, the confidence will improve once I start learning more. But again, I feel like part of learning is getting that mentorship from either your peers or from like an actual mentor, which I definitely got on the orthopedic side, but I never really got on the pelvic floor side, which, I mean, I guess I could have paid for it, but like with money, I mean, but I never did. So, and here I am. But yeah, so that was that. And then, next, after I started my practice, and then I decided to go in like full time, maybe a little bit before, or I joined a business mentorship group, and this was before I went all in on my business full time. And in the mentorship group, they strongly encouraged niching down, which makes sense. Like, if you're gonna start I wholeheartedly agree, if you're gonna start a cash pay business, like, there needs to be a reason, that something that differentiates you from being a super generalist, because otherwise, like, what makes it, you know, why would someone see you versus going to a normal quote unquote normal physical therapy clinic and use their insurance? But the only thing is that, like, they kind of pushed me towards being only a pelvic floor PT, which is something, again, from the very beginning, is not what I wanted to do. Like, I wanted it to be like 50-50. Nowadays, I feel like I want it to be closer to like maybe 60 to 70 orthopedic, and then like 30 to 40 pelvic, but I'll get to that in a bit. But yeah, this mentorship group really pushed me towards being a pelvic floor PT only. And so I feel like I tried that for like a whole, at least over a year, into my own pregnancy and then kind of postpartum. But it's like this entire time I felt like I was a fraud. Like, I felt like not a fraud. I don't think, like, it wasn't that bad, but like I felt disingenuous, I guess. Like, compared to some of like some other pelvic floor physical therapists, like, they eat, sleep, breathe pelvic floor physical therapy, but that's just not who I was. Like, you know, again, I was also interested in orthopedics. So yeah, like, so even as I'm trying to push me being a pelvic floor physical therapist, like, in the back of my mind, I'm like, you know, I'm not just a pelvic floor physical therapist, but again, like, I'm paying money for this business mentorship, and like, they're telling me to do this. So I'm like, I'm doing this, but nothing is like, you know, this isn't like, or in addition to that, people keep telling me like, oh, there's a lot of money in pelvic floor physical therapy or whatever. Like, a lot of women need it, which I agree, a lot of women need it, but the whole money thing, I'm like, that's not why I'm doing this. I'm doing this because I literally want to help them. I mean, I don't necessarily care about the money. Like, yes, I would like to pay my bills, but like the whole point of doing this is to help women, not because it's like lucrative or whatever. So, but yeah, so I'm just like warring with it, and then like my practice is like barely scraping by. And then I have my baby go on maternity leave and even postpartum as I'm coming back, even when I was pregnant. So what I eventually realized through going through pregnancy and postpartum myself, is that this space is so polarizing. Like, it is very polarizing. And even though pregnancy, postpartum, it, as part of like a holistic like pelvic floor practice, like some people will only focus on pregnancy and postpartum, some practices, but like it's just one part. It's not, aside from the ones that only do pregnancy, postpartum, like most pelvic floor physical therapy clinics are going to see other things than just pregnancy, postpartum. But I think like going through pregnancy myself and then postpartum myself, like obviously I'm going to be thinking about that. It's going to be at the forefront of my mind, the front of my mind. I don't know. Whatever that saying is, you know what I mean. But yeah, I never really realized how polarizing the space was until I like experienced it myself going through it. And a lot of it, and when I say polarizing, there are very distinct like camps, so to speak. Like, for example, there's the ones that are like vaginal birth only, and then it's like, I don't want to say there's like the other side where they're like C-sections only, but it's like it's either vaginal birth only or all natural birth only, or there's also like the breastfeeding versus formula. And yeah, it was not good for my mental health, to be honest, because even though I'm the type of person that I want to be like, oh, you know, whatever works for you, and even though I myself understood like, well, when it came to the C-section, because I had a C-section and it was because my daughter was breech, so it was planned. That wasn't really something that I was disappointed in, which I thought it was surprising because she's a coach, so she's not a pelvic floor PT, but she's like a pregnancy postpartum coach. And when she asked me how I felt, it was as if she was expecting me to be disappointed that I couldn't have a vaginal birth. But I was like, I mean, I'm a little bit worried about the recovery aspect, because I did want to, you know, be more active. But in terms of like vaginal versus C-section, I didn't really have a super preference one way or the other. But man, when it came to breastfeeding, like that's such a polarizing topic as well. Because even though logically I understood like fed is best, it doesn't matter. Like when I struggled with breastfeeding, it was a huge thing. And I'm sure like the sleep deprivation and hormones played a part as well. But man, that was, yeah. So all of this to say that the pregnancy and postpartum space, there's women who are either pregnant or postpartum are very vulnerable, and I can attest to that firsthand. And for this population to be so vulnerable, I don't want to say they're predatory, because these people like actually believe what they're saying is correct, but it is still predatory, basically, is kind of where it's like, oh, if you get a C-section, you failed, basically, or if you use formula, you failed. And So all of this came to a head actually recently. So it's been almost 2 years. It's been over 2 years since I've been pregnant. But there was a post recently about vaginal tearing with a vaginal birth. And if women want to have, they're adamant about a vaginal birth, that's fine. But then a lot of women appear to not be told the risks of tearing, and so they end up getting blindsided later on versus so this post is basically saying we need to be informing women of the risks associated with vaginal births and not just C-section births, because I think when I was pregnant it was kind of or I don't know, I had the information, so I knew there were risks either way. But I feel like people who don't have the information, so people who aren't in a pelvic floor space, they hear the risks for C-section and they're like, well, then vaginal birth is safer or whatever. But there are still risks, and so knowing about them helps women to kind of prepare so that if something happens, they're not blindsided. They're not like, oh my gosh, I didn't know this was going to happen. And then they have resource, and if they're aware of it, if they're informed of these risks, then later on they have resources to help them recover. And so that's what the post is all about. Just saying we need to inform women about these risks so that they know, and then also strategies for reducing the risk of tearing, and then also ways to help recover so that they don't have to deal with issues with the tear later on. And one of the comments, so it said nothing about oh, you need to, if to not tear, you need to do C-section. No, it the only time it mentioned C-section was saying oh, women are told risks for C-sections but not vaginal tears, and that's the only time that it mentions anything about C-sections. So one of the comments under this post was oh, this is, I'm tired of people pushing the narrative that they should have C-sections or whatever. Vaginal birth is best and it's the most natural and all women should have vaginal births. We need to be pushing towards vaginal births only. And I'm and I felt compelled to reply because I was that's, first of all, it's literally not what the post is saying at all. And secondly, yeah, maybe some women want a vaginal birth, maybe some want a C-section. In the end, the only person whose opinion matters is the person giving birth. It's not we shouldn't be forcing our own opinions and opinions and judgments on the person, basically. And when I made that when I saw the comment and replied to it, it just made me realize just how polarizing this space is. And I'm I am not gung-ho enough, for lack of a better term, about this space to wants to deal with these constant arguments all the time. And because that's what it is, whenever we post, and the same thing happens in the orthopedic side too. I'm not going to say it doesn't happen there, but I don't know, for some reason it's just hits different in the post-pregnancy, postpartum. I don't know, somehow it's more aggressive, and maybe it isn't, but maybe it's because that population is more vulnerable than the orthopedic population. I don't know, but I was just yeah, this is why I have slowly started pulling away. And I still enjoy helping people with pelvic floor PT, but I also realized the more complex things the pelvic pain and the surgeries and everything else, I'm not as interested. Well, again, going back to the confidence, I just, the confidence isn't there. I guess I can pay for mentorship, but I am not interested enough. That sounds bad. I don't know. It doesn't sound good to say, but that the truth is I'm not interested enough to pay for mentorship to learn more about those things when there's all these other things that I am interested in and that I am good at, both on the orthopedic side and on the pelvic floor side. So on the pelvic floor side, like the thing that I'm interested in the most is helping someone be able to run, lift, jump, do CrossFit, like do their sport or activity without pelvic floor symptoms. Like that's where I get the most joy, is like helping women realize they don't have to live with like peeing their pants when they run or whatever, or like wanting to be active, but worrying about when they're going to pee their pants, like, and helping them realize that and then helping them achieve it is so rewarding. Like I love that. And it plays into like what I love about orthopedics as well. It's like at the end of the day, I just want them to be able to do like, do triathlons, do high rocks, do CrossFit without their symptoms, pelvic floor or orthopedic, interfering with it. So yeah, that was just kind of the realization I had. It was really gradual, but it's not something that like it took seeing that post about the vaginal tears for me to kind of realize like that's where I'm at with pelvic floor. And at the end of the day, like I see my job as helping people make more informed decisions so they can pursue what matters to them. So that they can make decisions that work for them the most, to an extent. Like I want them to be safe too. But like my job isn't to put my own opinions on other people. So same thing as, so like, the CrossFit hating pelvic floor therapist, like I am not about putting my own opinions on someone. Like I am fully for supporting someone, giving them all the information and helping them come to their own decisions, come to their own conclusions about, what decisions that they should make for their health. And I don't know, somehow I don't even want to say the stakes seem higher in pregnancy and postpartum. Like maybe they are a little bit higher, I guess, but than orthopedic, I feel like, because you are also considering like a baby. But I don't know, it's just that like all of that baggage just didn't sit right with me. So yeah, that's why I'm pulling back a little bit on my focus from pelvic floor physical therapy. I still do pelvic floor physical therapy, but again, I'm only focusing on like the athletic urinary incontinence, and just urinary incontinence associated with activity or with like sports and stuff. And like I would feel comfortable with prolapse as well, as it pertains to like lifting, like managing your prolapse symptoms, like with lifting and running and impact activities. But again, like the common theme here is like helping women overcome their pelvic floor symptoms when it comes to activity and not just like daily life. And when I first started this, planning for this episode, I was like, you know what? I feel like I've given up on pelvic floor PT. But after like doing the script and everything, or like outline, I didn't have a script obviously, but since I like have been going all over the place, but making my outline and everything, it's like, I still very much want to help women in the pelvic floor space. I've just narrowed it down. And I think also in the last few years, like I felt guilty about having such a narrow like scope of what I want to treat in pelvic floor, but I feel like I've realized it's okay to admit that this is what I'm comfortable with treating, because I know there are other pelvic floor physical therapists out there who are better than me, and or more knowledgeable, I guess is a better way to say than better than me. But, I would rather refer out to them for things that I know that they will treat better, than pretend that I can help these women if I don't feel comfortable. So I've realized, like, that's not giving up, is just being more specific. But yeah, it's so funny, this journey that I've had with pelvic floor physical therapy, where in the beginning, like, I've come to the conclusion that I want to help with athletic urinary incontinence, when that's literally like what brought me here to begin with. Like, that was my original goal, and I just kind of somehow got lost along the way. But now I'm back to what originally interested me in pelvic floor physical therapy. So, but yeah, that's all I have for today. And thank you so much for listening. And I will see you in the next conversation.